Welcome to DocTalk with your host, Brent Leavitt. And DocTalk with Brent is sponsored by Battleborn Financial.
Welcome back to another edition of DocTalk. I am Brent Leavitt, the owner and proprietor of Battleborn Financial Advisor and health insurance broker here in Pahrump. We are representing P3 today. You can see on my shirt here. We're talking with Dr. Harding. He is the main guy over at P3 Medical Clinic here in Pahrump. If you haven't a chance to meet or see P3 doctors, if you didn't hear my Chaudhry Bonds interview earlier, you're going to love this interview. Dr. Harding has been in Pahrump in the community for about, I think, the last 10 years. Is that about right, Dr. Harding?
Correct. Yep.
Yeah, 10 years.
10 years.
He's been out here for a long time. He complains about he's here in Pahrump doing at the clinic stuff more than his own family. So he loves the Pahrump people. He loves dealing with us and working with us. And I love what they do at P3. Talking about insurances, we'll talk about that later in the show. Talking about insurances, they have worked hard to try to get those to work with the different companies and really be centered around patient-centered care. I think the biggest complaint we get from people that deal with some of the big corporations is getting access to their primary care doctor and feeling like they're treated like a patient. And the whole thing from the beginning, P3 was, we're going to focus on the patients. That's the whole P3 stands for, it's patients, people, and passion. And they talk about making all those three things come together and dealing with their patients. They give their doctors a lot of freedom to practice medicine as they like to. And I think that's the biggest selling point for me when they came here. Yeah, exactly. Sorry if I interrupt you there. But Dr. Harding is wonderful in what they do. And open enrollment is right now. So right now, if you guys are in a Medicare plan, is a great time until December 7th. You can roll on a Medicare plan. And these guys take almost every Medicare plan except for two. They take 4 different companies. So they take Allwell, they take Anthem, which is new to Pahrump this year, if you didn't know that. They also take Senior Care Plus, and then they also take Aetna as their providers. And they have a great relationship with all 4 of them. And if you're looking to change your plan this year, even if you're on an old plan, we can move you to, it's always going to take a look at them every year just to find out what's changed on your formularies, drugs, doctors, things like that, and get to know it. That's what that's what we do at Battleborn, is help you get those doctors and match you up with the plans. For those of you under 65 on the exchange with Nevada Health Link, they actually take, of the 5 carriers that are available to us, they contract with 3 of the 5. So we work heavily with Friday Health Plans. They're working with Health Plan in Nevada, and they're also working with Ambetter. We have 2 others this year they don't work with, but they do work with most of them. And honestly, HPN and Friday are the best pricing on the silver plans this year. So we see a lot of people move to those plans as well. With that being said, I want to introduce Dr. Harding a little more and have him talk. Today, they want us to focus a little bit on flu and a little bit, this is the season as well for flu stuff. And in fact, this morning we were at a clinic at your office and dealing with, we did a little flu shot clinic for people over 65. So tell us more about talk about your flu stuff there, Dr. Harding.
Yeah, no, exactly. I mean, I'm a huge proponent of vaccination. This is the season for flu. I mean, pretty much from October to about March, flu is an issue. Obviously, with the current ongoing coronavirus pandemic, there's even more risk with that. So conceptually, to me, mentally, if you have the ability to be vaccinated for one of those illnesses currently, that would be a good option for patients. I mean, the flu vaccine is essentially recommended from age 6 months and beyond. We do offer the high dose flu, which is essentially 4 times the regular strength flu in our clinic, and that's approved for 65 and older. If you're under 65, you would just get the routine flu shot, which you can do at any local pharmacy. But it's an annual shot, and the shot is based on the year's previous most common flus. So.
Yeah, that's one thing that was a revelation to me this morning, was talking about the high dose for over 65. Why is it they take a higher dose? Is there something with that's different?
It just helps them to build adequate immunity. I mean, sometimes when you get a little bit older, your immune system doesn't kick in as well. So by getting a little bit more exposure, your immune system kind of takes over a little better. That's kind of the concept there.
And do most of the pharmacies and stuff, I know people get flu shots at pharmacies and stuff, is that different going there versus going with you guys at the clinic, or is there?
Would offer the same flu vaccine, so now again, it's more age dependent, like I said. So, but yes, so in our clinic in particular, we only have the flu shot for 65 and older to give out to the general public. But the regular pharmacy would have that in addition to the, age appropriate one for you per se, for your age group.
Yeah. So it's important to kind of know where you're at. And that's why we always talk in this show about going to see your primary care doctor. Don't freak out about that. And the flu vaccines, pretty much every insurance company is actually covered at no cost too. So a lot of people think that, oh, I got to pay money or whatever it is, but and it sounds like it's always free, but the insurance pays 100%.
And it's not only flu too, Brent. I mean, we can talk, there's pneumonia shots that are out there. There's other things. I mean, it's just the way I look at it is, the more you can protect yourself, the better off you're going to be, especially in certain patient populations that have other comorbid conditions. If you have diabetes, if you have heart disease, if you have COPD, if you're a smoker, you're just more at risk if you get one of these illnesses. So if you have the ability to protect yourself from it, that's the way to go.
Yeah, I think one of the COVID stuff is we've brought to life, everybody talks about the numbers with flu deaths and COVID deaths, and we forget that flu is even a big deal in that stuff, and we ignored it a lot of times because it's so common to us. We forget that it's even a common thing, and getting ourselves vaccinating is important on there because we don't think of like, hey, wait a minute, maybe I'm high risk for other stuff or for COVID, but you forget you're not just high risk for COVID, you're high risk for the flu too. And that can be just as deadly, if not more so sometimes for some people.
Correct. Are you talking about for flu?
For flu, yeah.
Yeah, absolutely. I think you're 100% right about that. I think, it's not uncommon that we have about 80,000 or so deaths a year, and it's just kind of, well, it is what it is. It's the flu, But obviously, it's a different sort of season and climate right now in the country, and I think that's why, there's such an intense, on what's going on with the current pandemic. But the point of it is yeah, the flu is very common. We see it all the time. The other thing to keep in mind about that, I mean, symptoms between those two illnesses are very, very similar. Flu, typically, it's very abrupt onset. You just get sick very quickly. Usually you feel feverish, you could have cough, shortness of breath, fatigue, just not feeling right. I would encourage you to see your primary care, get to your doctor quickly, because unlike COVID, with flu, we do have medications, antivirals we can use, but you pretty much need to start on those within about 48 hours. So like most doctors' offices have the ability to do a rapid flu test in the office. So then, you can come in with those symptoms, get swabbed. Oh, yes, you have flu, you have type A, here's the antiviral. We can get you on that medication right away. And it definitely cuts down on the days of symptoms and just, you improve quicker with those medications.
Yeah, that's amazing. I think it's usually Tamiflu and things like that you guys usually prescribe. Is that right?
Yeah. Mm-hmm. And it's set doses. It's very easy to do, so.
It's always, and it's a quick shot to the doctor's office, things like that, get tested. You're not waiting days on end to get tested for the flu and things like that, which is nice.
Yeah, I mean, I think a lot of, with the current situation with Corona and that, if patients come in sick, I think most providers are using a little bit of a shotgun approach in the sense that we often test the patients for flu. We test them for strep if they have a sore throat, and then we also send in the nasal swab. Not all offices are doing COVID testing, but our office does, as an example. So then there's a delay in that. The other tests are rapid, so we know right away whether or not you need to be treated. And then that one goes off, and we usually are getting it in 2 to 5 days, but it's usually closer to the 2-day mark. Those there are some treatments, but they're kind of more, if you're needing hospitalization, they're not really treatments we do in the outpatient world. But in reality, there's advice like stay home, isolate, have loved ones tested, that sort of thing. And then, we pretty much have daily follow-up with those patients if they turn positive, and kind of keep an eye on them and just monitor them if we need to really get them to the hospital or not eventually.
Yeah.
Too, flu is here, I mean, it is what it is. We just have to be smart, take precautions.
Yeah. One of the things I like about your office, what I'm focused on too, is you guys actually do a walk-in clinic in the mornings, right?
Sure.
Yeah. What time is that?
I mean, I've been doing this for a couple decades, and I've over the years, I've had different types of jobs over the years, but like you alluded to, I've been out here for 10 years. And as a general statement, especially when you see seniors like to see their own doctor, right? Yeah. And it's very easy to overbook your day and people have no availability, but patients don't like that, right? So I kind of came up with the concept for out here when we opened this office, which it's our 2-year anniversary right now, recent, basically. But that the first hour of the morning, just allow walk-ins for single issue type concerns. So then the patient always has the ability to come in and see their own provider. I mean, if you're really sick or you're having problems, I mean, there's always the urgent care or the ER if needed. But as a general statement, if you're not feeling great, just knowing in the back of your head, well, I'm not dying. I could see Harding tomorrow morning at 9 a.m. That's the way I want patients to think. And it's just better continuity of care. And then, we know there are other medicines, we know there are other problems. So it's just easier to prescribe meds and kind of keep people doing well,
I think that was an ingenious idea. I want to give you credit for that because I tell clients about that all the time. When I'm saying you want to see Dr. Harding, it's always, they have this great walk-in clinic. I mean, they'll let you in the first hour of the day, they'll get you in to see them. You would see your doctor and you have access to care. That's the biggest complaint I get from everybody is just, I want to see my doctor. I don't want to just be brushed off into this other doctor or this other PA or something like that. And you guys are very responsive. I mean, even if you're not available, Chaudhry's there too. And we interviewed her last time and she's phenomenal as well. I mean, don't want to put that off as well of the options as well. And all the P3 plans that you guys take, whether it be there's pretty much all zeros this year doctor too. So you avoid that urgent care copay that you would pay otherwise. And you're not have to always necessarily call the 800 number to talk to the teledoc doctor. You're actually talking to your real doctor, which I think a lot of people really enjoy that. And then you guys have that, you guys will test for flu, viruses, and things like that. It's always knowing that, hey, I can come to the doctor that day, feeling I'm a little under the weather, and knowing you're going to get treated by your actual doctor that knows you, as much as some guy on the video conferencing thing that doesn't know you from Adam and just like, well, we don't know his underlying conditions. We don't know what other issues are going on with you. They know it a little bit better.
No, you're 100%. And Brent, we do have protocols in the office to limit exposure for other patients as well. I think we do a good job of that. We essentially are trying not to have patients sitting in the waiting room at all. When patients come in and we recognize them, even new patients, we're sort of trying to shuffle them right to a room so they could even fill out paperwork and that, so people aren't congregating out front in case we do have someone who's positive. We had a positive patient just the other day, and then the wife wanted to be tested, so we tested her at her car. So again, just the possibility that they could transmit it in the office, we pretty much, we have all the PPE and all the routine stuff, but we have a procedure in place to try to limit exposure. We literally have a sick hallway and a well hallway. So when people come in sick, we put them in one area of the clinic where it would be difficult to get it from there to the other side where the well patients are. So we're trying to use common sense stuff, but it's always a challenge, because you never know what someone's walking in with, right?
Exactly.
But the point of it is when we have a little heads up where you can tell right away, oh, this patient's sick, we kind of get them to one of our sick rooms, and those are sterilized right after the patient leaves and stuff. So I think we're doing pretty well with it.
Awesome. We're going to take a quick commercial break. We'll come right back, and I want to talk a little bit about, we're talking more about flu vaccines and stuff like that. And I want to talk a little bit about some of the concerns a lot of people have with not taking it. I want to go over that a little bit, and we'll talk back in our next section. So stay tuned, please.
Welcome to DocTalk with your host, Brent Leavitt. And DocTalk with Brent is sponsored by Battleborn Financial.
Welcome back to DocTalk. This is Brent Leavitt, Battleborn Financial Advisor and Health Insurance Broker here in Pahrump, Nevada. We also have a reminder, we have this goes to Las Vegas markets as well. We do have offices in North Las Vegas and South Las Vegas. We're joined by the P3 Medical Group. I'm actually representing today with the shirt. I'm here with Dr. Harding, who actually is in Pahrump. They have clinics in Las Vegas as well. Again, we're talking about a little bit about flu virus and vaccines today. And I'm going to talk as we kind of continue the conversation, a lot of people have concerns about vaccines. And I think we want to touch about that more of, we talked about why to get them. It's important to inoculate yourself. But a lot of people I think they always tell me, I get vaccinated, but I don't want the flu vaccine for whatever reason. What kind of stuff, Dr. Harding, do you see people, why don't they want to get a flu vaccine? What's the concerns they have usually about that?
Well, I think, the primary thing that I've heard over the years is that last time I got a flu vaccine, I got the flu, and I was the sickest I ever was, that sort of thing. I think patients have to be educated and reassured that the flu vaccines that we're giving in the office at this point are not live shots, okay? So this is basically, like I had said in our earlier episode, kind of the most common flus from the year before typically is how they make the vaccine for the following year. And then it's kind of a chopped up virus. So the virus itself is not live. Now, that doesn't mean by getting the shot, you may not have a reaction. Like you could feel sore, you could feel feverish, you could feel a little sick, but you don't actually have the flu. And I think, but years ago, there are still live flu vaccines that can be given even now. Those are the nasal spray versions, but those are not ones that were given in the office. So, but I think in the past, there used to be live vaccines. So patients would potentially get sick, just like the original shingles shot was a live a vaccine actually as well. So, but currently, what they're saying really, what they're reporting isn't probably correct in reality.
Yeah.
And like I said, I'm a huge, in the previous episode, I honestly feel that immunization is one of man's greatest accomplishments, truthfully. I mean, when you go back, years and years ago, I mean, how many people would suffer from different conditions like polio and stuff. And then once vaccines came about, I mean, these things are essentially eradicated from Earth for the most part. I mean, it's really pretty fascinating.
It's fascinating how they even came up with the idea of vaccines. I don't know if you noticed, but the word vaccine comes from the word vaca, which is actually a cow. And they actually got it from actually the handmaidens during the Black Plague, and they actually found out that they actually got blisters on their hands. They started using the actual live viruses to give to people back in the day. And found out the rich people were the ones that can get vaccines because it was like a big deal to get those pustules and be able to get them so you wouldn't get the actual Black Plague and stuff. And that's translated today. Now we don't even use the live stuff anymore. We don't have to. We can kill the viruses. And it's a big deal now. It's like, hey, we're giving ourselves a little bit to make our bodies even better. And it's made us live longer, live better lives just because we vaccinate ourselves. It's important because, I mean, just imagine just if we were all sick all the time, we'd be running for our lives no matter what. But we get this immunity now. We can just give ourselves every year to boost our immunity even better to the next level. And we can be even better, especially now that if you've been home, shut up for a long time, and then all of a sudden you decide, oh, I'm going to go out to a friend's house or a party or something like that. And by being vaccinated, at least, you're not at higher risk to get that illness. And flu is nasty. I mean, I don't know anybody that loves getting the flu any year at all. If you ever get the flu, it's like you're just constantly, you're throwing up, you're just feeling like junk. Even if you're vaccinated, you might get it. But at the same time, it's like, I'll tell you what, when I get vaccinated, for me at least, if I do get the flu, whatever, my symptoms are far less than if I didn't get vaccinated.
You're 100% correct.
Yeah.
In other words, you may not be 100% protected, but typically the symptoms you would have would be less. So you're 100% correct with what you said there.
Yeah. Now, what do you guys do about, I know the way they make flu vaccines now, it's like they actually do use like chicken eggs, things like that. Are there concerns of people that have some kind of egg allergies, things like that as well? Or is that an issue anymore?
Yeah, there's basically a standard questionnaire patients do to ensure that they're safe to receive the vaccine. And, there are some different ones that are made different ways for certain allergies that can still be used. But as a general statement, the risk is very low, and most patients tolerate the shot just fine, So I would keep an open mind, try to come in, talk to your provider, and just be fully informed and make a decision.
Yeah.
That's the way I would approach it if I was a patient.
Yeah, and listen to the science. I mean, the biggest thing I think now is all people, it's hard to know what's real science, what's not. I know that, hey, your doctor's gone to medical school, he knows about these things, and it's not that they're trying to put chemicals in your body that's going to cause you to get sick or control you or anything like that. It's more about just trying to get you healthy and build up your body immune system.
100%. I mean, I think as amazing as the internet is in so many ways, I think there's some misinformation and disinformation out there that's a little concerning too, right?
Yeah.
So I think, patients can review what they want, and they can always feel free to print something off they have a concern about and bring it in and we can discuss it. But just trying to have an open, honest discussion with the recognition that the provider wants to do what's in your best interest, get you informed and then you make an informed decision. I mean, that's kind of our approach here, patient-centered, right?
Exactly.
And that's, and I think, there's so much information out there that it's hard to digest, for patients. So I think, if they see something concerning and, bring it up, bring it in, print it off, and we can go through it and kind of take it from there.
Yeah, and that's I know back to healthcare too, just getting your health plan. A lot of our patients, it's more about people come in just to get the health plan that meets their needs. It's so confusing. There's so many choices. It's like, how do you figure out which one to pick? It's like, oh my goodness, there's so many choices out there. And that's why we have brokers too. We're kind of like, in a way, like your first thing of trying to say, hey, come in to see us. We're gonna help you with your plan, go through what medications are covered under the plan, which doctors are on the plan. I think you guys had a couple instances where somebody bought a different plan, let's say Humana, for instance, which you guys don't take, and they got the plan and realized that, oh, I want to see Dr. Harding still, but it's like, well, you're on the wrong plan for Dr. Harding, unfortunately. We got to get you back to Dr. Harding's plan. So it's important that your agent and everybody understands that there is a doctor list and they understand that, hey, we need to get you the right plan they take. And honestly, the plans they take are phenomenal. just so you know, they all include dental, vision, hearing, transportation benefits. Those are included, just like the ones you see on TV and the commercials. But trying to trust somebody on the TV or commercial necessarily isn't going to put you on the right plan for your doctor. It's important to know, it's just like the ground level, knowing your primary care doctor, not just some 800 number doctor. It's good to have that person on your list. So it's important to know that.
So we obviously do not give advice on any level about insurance, right? We refer patients to brokers. But I mean, I think just the 3Ds, I think they always talk about, right? Dollars, doctors, and drugs. You know, are my meds covered? Is my doctors, these are the doctors I see, are they in there? And how much is this going to cost me? I mean, I think typically if you answer those three things, most patients then are satisfied with that plan, right? But I kind of let that up to you, Brett. You know, I could talk about flu and getting you on Tamiflu and doing all these things, but that the world of insurance, I try to avoid.
Oh yeah.
But it is what it is, you know. But definitely, certain plans work better for certain patients depending on their lifestyle and other things and their needs. And it is, you know. So, but you're right. You got to match the right patient. Otherwise, there's a lot of dissatisfaction there, right?
Yeah, and you're stuck like, why am I paying so much for my doctors or things like that? And sometimes we get confused too. We think that because we're paying a lot for doctors, we forget we're still insured. There are some plans that do have high deductibles, things like that, but understanding that, hey, maybe you don't really want to pay so much to the insurance company every month. And it's kind of important to understand what you're paying for, because even on Medicare, people think I'm getting the zero premium plan. Yeah, it's zero, but you're still paying for it through your tax dollars and everything like that. So you want to make sure you're getting what you pay for, even if it might be not much out of your pocket.
Free?
What's that?
Are you trying to say everything's not free?
No, nothing's free in this life. Yeah, no such thing as a free lunch, right, Milton Friedman? But yeah, so I mean, it's just important to get those done and understand, because I don't know if you knew this, but on Medicare stuff too, these plans actually get a thing called a star rating. And those star ratings actually affect how they get reimbursed by the government. And if they're not getting good outcomes, they're not treating their patients right, though, and the doctors aren't doing their jobs, and if the health plan isn't making sure that you have access to your care, they actually get dinged on their star ratings, and they actually will lose funding from the government. And those are very important. And if you actually get a chance, every plan has a star rating. I know people don't realize it, but you can go to Medicare.gov and you can see those star ratings as well. Your broker's supposed to bring those up with you when they talk about the plans as well sometimes. Understanding that, hey, this is a 3-star plan, average plan, or 4-star plan. It helps you know, hey, wait, is this a plan I should probably avoid because of their star ratings or not? Those are things to kind of pay attention to, at least when making a choice. Because it could affect care in the future, because if they don't get enough reimbursement, it's hard for them to really pay for the care that you need, give you the extra benefits such as the dental, the vision, the hearing stuff that you get, you like, and you love about your plans. Even as simple as paying for, for COVID testing or even paying for flu testing. Those things are important to keep those plans up. They want to make sure you're satisfied. All the plans want to make sure you are satisfied. You might not feel it sometimes, but they do. And now at P3, do you guys I know your plans on the Medicare side, do they require referrals? Have you found that to be an issue with getting referrals for patients and stuff too?
For getting referrals?
Referrals and things like that, or has that been a big?
I feel like we have a pretty solid referral network in place, actually. And even out in Pahrump, a fair amount of the specialists do rotate out here. So I think overall, I mean, again, when you choose to live, 60 miles from a major metropolitan area, there are some limitations in care, right? Yeah. But the point is, I think we're pretty cognizant of that, and we do have a decent rotation of providers who come out here. So a lot of things can be addressed locally. I mean, even some of the procedures and stuff that always had to happen in Las Vegas are now happening locally. So, I mean, I think a lot of that is just so much more convenient and better for the patients, But I mean, most specialties are represented out locally now.
Yeah. Do you have specific, what kind of specialties are out here that you find that are easy to get access to?
Yeah, I mean, we have full-time cardiologists out here, actually. Neurology rotates out here. Urology comes out here. Psychiatry comes out here. I'm trying to think. The two big ones that don't come out yet that we have trouble with is rheumatology, and there's only a few rheumatologists in Las Vegas, so trying to get them out here is really difficult. And then pulmonary also is one that does not come out here. I believe endocrinology is rotating out here. Surgery rotates out here. And I mean, and just as an example, a lot of simpler surgeries are now happening out here at the local hospital, like hernia repairs or gallbladders, that sort of stuff. And also some screening procedures like colonoscopy and endoscopy are all happening locally now too. on a regular basis. So there's a lot of stuff. Oh, we have orthopedics as well. So, I mean, there's a lot of stuff that's going on in Pahrump, which I think is great, for the patients, because, if people don't feel well, driving 60 miles is not, they don't like that, that concept either. But it takes a while to get that all set up and developed, right? And then schedules have to coordinate and you have to get the providers out here. But I think overall it's doing fairly well.
Yeah, it's wonderful. We have wonderful primary cares. This show is a highlight all that. And I want to say we're running on time, but I want to thank Dr. Harding. He's been phenomenal, great partner to work with. P3 Medical Group. If you didn't know where they were before, I mentioned that they're off of Lola Lane, 360 South Lola, right next to the hospital. Easy to access to get into. Their parking lot's pretty easy to park in. So we got to kind of go around the hospital a little bit to get there, but once you're there, it's really easy. They're kind of friendly service. Their front office staff is one of my, they're great to work with. I mean, knowledgeable staff. That's the biggest thing about doctor's office. Get to know their staff and things like that. Know what they're talking about. Give them a call, check them out, and hopefully we'll see you again next week. Thanks again, Dr. Harding. I appreciate it. And we'll see you then. Thank you.